You can edit this bit, Wendy. Hello, friends. I want to share with you the new Pusen single-use digital flexible ureteroscope with integrated suctioning system. It's not just portable with enhanced sterility, but it also brings you the fully digital recording capability and, of course, an integrated suction system. And I'll show you the advantage of that. So this is the new Pusen scope, which has got the suction in addition to the smaller size. It has got the usual features, but in addition, it has got a suction valve with a suction connector and an integrated T-connector or lever lock. If you look at it, you've got the standard irrigation port there. You've got the lever lock, and you've got the irrigation suction device, and the actual suction valve can move from both ends, and the deflection is similar to the previous Pusen scope. So the irrigation suction device is really quite good, which you will see in the next slide when we put it to use. So what is the main advantage of this? Apart from everything else, the suction really makes a huge difference to when we do the procedure. Let's see the suction and how it works. You can see here the irrigation is connected. You don't have to stop the irrigation, and the suction will just work intermittently as and when you want. And it creates a negative pressure each time you press the suction valve, and then you get the fluid suction. So let's see a clinical application of this then in real life. We had a 48-year-old patient with a large 2.1 centimeter stone and a history of recurrent urinary infections. And our objective was to fragment the stone using suction to suck the debris, minimize operative time, and low intrarenal pressure. And here is a live case. Now, the advantage here is when we do the suction device, we are not stopping. We are almost continuously irrigating, and you can see the fine dust and debris is continuously getting sucked out. So the procedural time, you don't have to wait for the debris to clear, or you don't have to put extra irrigation. And because you're sucking all the time, you're not worried about high intrarenal pressure or temperature. And you can see how the debris just gets sucked out, and you can carry on with the procedure as you would normally do without worrying too much about the debris floating around, about the pressure, the temperature. And here the stone is in the lower pole, and you can see again continuous visualization, and you can continue to just carry on without worrying about the laser. The suctioning device doesn't let the scope block because it is constant. And here you can see the fragments are small enough, but again the suction allows you to softly remove the debris while continuing to break the stone. And I think this is a feature which will not just allow us to do standard stone treatment, but it will improve our capability for large stone treatment, especially stones which are infected, because we are not worried about the temperature or the pressure. And we can use the pop dusting technique, which is a technique which is well known. And here you can see again the debris constantly being sucked out. So for me, this is going to be a go-to scope in the future for all cases, and you can probably push the limits. Here at the end, we see that you have soft debris that is left behind. The vision is very good. And as we come out, you can see again with suctioning, which you are in control of, you can continue to aspirate the soft fragments. And as you come out, you will see that not just the fragments, but the debris on the ureteric wall also slowly gets aspirated. And you can have enough for stone analysis. And the beauty of it is that the suction doesn't even get blocked. So for me, I think this is going to revolutionize the world of endourology. So my first impression with this new scope, it's excellent flexibility and maneuverability, good vision. Suctioning allows the debris to be cleared, and also you can hence go faster without worrying about temperature and pressure. And fragment retrieval can be done through the suctioning system, which is easy, which will hopefully reduce the cost and operative time. Thank you so much, and hope to see you soon. Bye.